Now, we probably both know people with diabetes, but it is one of those things that we really don't know a whole lot about it, understand a lot about it, until we deal with it.
Yeah, and this is when we try to change that, because November is National Diabetes Awareness Month, an opportunity to become more educated.
To educate ourselves, exactly. So we asked Dr. Wes Ensley, a family practice physician with SouthCoast Health, to explain a little about what diabetes is, who it affects most, and what are some risk factors to look out for.
Diabetes is basically a disease regarding glucose. It's a mismanagement of the body's ability to handle glucose. There's basically two types of diabetes, type 1 and type 2. The basic difference is in type 1 diabetes, the body no longer produces insulin. And insulin is very important in order to get glucose into the cell to be used for fuel. In type 2 diabetes, it's a problem with insulin resistance. So the actual body's tissues don't recognize insulin the way they're supposed to, and you get the same basic problem with glucose dysregulation, which is glucose in the bloodstream and not in the cell. And that creates a whole host of vascular complications. So definitely there are some symptoms. Unfortunately, they do tend to occur when the glucose gets a little bit high, and that's kind of not what we want to see. You know, we like to pick this up a little earlier, and blood tests and regular doctor visits are the best way to do that. But if you ever notice that your vision is starting to change or get blurry, if you get a little dizzy, sometimes you'll get queasy or nauseated, and a very common symptom is being thirsty all the time and feeling the need to drink a lot, and also having to go and void urine a lot. And we call those conditions polyuria and polydipsia. But those are very, very suspicious that you may have a blood sugar problem. The two greatest risk factors to developing diabetes is obesity and alcohol use. So you definitely do not want to be someone who's got a body mass index over 35. You certainly don't want to put down a whole lot of alcohol. That's sort of a sure path to developing a glucose problem. Certain subsets of people are also at much higher risk. American Indians have a 15% rate of diabetes, followed by African Americans, which is about a 12%, and then the Caucasians around 7%. But there's a very strong correlation with diabetes and family history. You can do everything you're supposed to do and eat right and be active and healthy, and genetically you can still wind up getting that insulin resistance. Diabetes is the 7th leading cause of death in the United States, and so people sometimes say, yeah, diabetes, whatever, but it's the 7th leading cause of death. So it's a very serious disease. It affects 10% of the American population, and that number is expected to grow, unfortunately.
It's something that can really impact your life, too, if you develop it. And there are ways to kind of hold it off for as long as possible. And, doctor is telling us some of those there.
Yeah, I have a physical coming up next week, which seems like the worst possible time to do all of this right after right in the middle of the holidays. But yeah, and had to go get blood today, so we'll see how that turns out. But it is one of those things where he talked about you can do a lot of these things, and sometimes it may just be totally out of your control. It may be genetic.
Yeah, you can't always control your genes. So.